Hi, welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, and I have Ashley Williams here with me talking about advanced surgical of Bel Air and bundled payments for procedures and the Free Market Medical Association. There's a lot of amazing options out there that, we can get treatment as patients and we don't have to go through insurance companies technically anymore because there's options that we have now. So welcome back, Ashley.
Thank you so much. I appreciate it.
So to continue our discussion, I wanted to talk about what's a little bit confusing to me in learning about this new model. Can you describe the flow? So let's say I have my primary care, and then that primary care recommends I go see a surgeon. How do I get to you guys? Or is my primary care, can they be part of this group? Or how does that all work?
Yeah. So we have, it goes back to the different referral sources, right? So you have your cash pay. Those patients, they don't need a referral. It's truly if you are having knee pain and you think you need an orthopedic consult, you call up, we get you set up with an orthopedic surgeon. So that's one avenue. When you are with a self-funded employer group, you usually have a care navigator, someone that goes on and helps you to coordinate this care. And so when you're with that employer group, you have a designated primary care doc that you're going to, or however your plan is set up with them. So you go to your primary care doc, they recommend, they do an MRI. They say, okay, you need to go see an orthopedic surgeon. So then at that point, that care navigator looks at the patient's location, looks at the surrounding facilities, who's in network with their self-funded employer group. So basically, who's contracted to take these self-funded plans. And we are one of the very few in this area, not only the state of Texas, that work exclusively with self-funded employer groups. So we pop up for the Houston kind of surrounding area. Once we are on the platform and they're able to locate which facility that patient can go to, they send us a referral. It comes electronically to me. I look at it, I make sure that we have a physician or physicians that can accommodate this patient's consultation. From there, I reach out to the patient. I give them the options. I say, hey, if you need a knee procedure, I have these 3 docs. A lot of times I'll send the biographies to the patient via their email. They can research it, do whatever they need to do to feel comfortable with that surgeon. These surgeons are credentialed with my facility. From there, they make a decision. We set the patient up for that new patient consult. They go in for the consultation, and from there, they're scheduled for surgery if it's indicated.
Okay, so that's very, very simple.
Yep.
Much more simple than I thought it might be. And how about primary care physicians? Are you contracted with them, or are they part of this free market group?
Yeah, so that's a whole nother segment. So there's actually a movement that's direct primary care physicians, and it's truly a concierge type experience. So where these doctors are passionate about providing that patient with an elevated experience. They're of the same mindset. Free market, they don't go through traditional insurances. So a lot of these docs will set up programs, and it's almost like a membership program. The patient, if they sign up, it's a monthly fee, and a lot of times the monthly fee is not that much. And they have access to this primary care doctor, I won't say 24/7, but they have their cell phone numbers. They have providers inside the office that they can reach at all times if they have questions or they have concerns. They can do a lot of the traditional screenings that need to be done, the lab work. So it's really great experience. You cut out all of the hassle of trying to get insurance approval, go through authorization, get pre-approval for visits and waiting. There's a lot of times no wait for these types of physicians. You just have a direct line of contact with them.
Yeah, that's fantastic.
Yep.
I wanted to also ask you, I know Advanced Surgical of Bel Air is the surgery center, and then you have 2 floors in the new building. Let's talk about the first floor and what kind of services you offer there.
Yes.
I know you have an MRI machine in there, which is a big deal because everybody needs an MRI before having surgery usually.
Yes, so we have our surgery center, as I mentioned, it's a full medical professional building and brand new. We are on the 3rd floor. The 1st floor is also one of our entities, couple of our entities. We have full radiology suite. So we have a MRI machine, 3.0 Tesla. We have a full body CAT scan, so CT, 128 slice. We offer x-rays, ultrasounds. We also, within that, and all of these services are on that bundled plan as well. So these are all free market healthcare options. And so if a patient wants to pay cash for that imaging, we offer that. If a self-funded employer group's patient needs imaging, we offer that. So it kind of is the goal is to make it a one-stop shop to where that patient can come to one location and get everything that they need.
That's fantastic.
Within that, just aside from the radiology, there's a couple of entities there as well that are really exciting. So advanced body scan, that is preventive imaging. So that is really kind of giving the public access to take their own health into their hands, to be proactive about their care. And we live in a world, or a country, we'll say, to where access to medical treatment is not as easy as we think it is. And in order to get these diagnostic imaging studies, a lot of times you have to have symptoms. So if you go to their doctor, it's really kind of hard to get an MRI or a CT or some kind of diagnostic study without having significant symptoms. And so we offer you the capability to come into our facility and get these screenings being asymptomatic and having no symptoms. And so the goal of that is to find things that are going to not only early detection, so early detection save lives, that's kind of our motto. We want to find these things and get a hold on them before they progress and get worse inside your body. One other thing with that is, so if we look at what kind of kills people these days, it's number 1 killer is heart disease.
Mm-hmm.
The number 2 killer is cancer. So all of these scans that we do, especially the CT full body, we're looking at that heart. We're able to scan it, we're able to give a calcium score, and you get that report. You get it in your hands, you can get the imaging reports in your hands, everything. So we kind of are giving that to you after the scan and letting you be proactive about your healthcare.
That's amazing. I mean, I don't know who wouldn't want to do this. I mean, I want to know what's going on, and obviously I take really good care of myself, as do you, and to know if you can be proactive about something before it starts, before you even have to suffer from symptoms and get things treated, it's huge. That's really a game changer for a lot of people. Is it expensive?
So we offer different packages,
Okay.
and the best thing to do is just schedule an appointment. It's
Yeah.
free to make a consultation. It's free to make an appointment. We can give you a tour of the facility. You can see, what equipment we're using. Within these packages, the offers that we have, we can customize it. There's the full body CT. We do an MRI of the brain with a neuro reader component of it that's an AI algorithm. So it's AI technology.
Oh, that's neat.
What we do with that is scan the brain, and we can detect early Alzheimer's, dementia, vascular changes of the brain, volumetric changes of the brain. And then kind of moving to the full body scan, we scan from the shoulder to the thighs. And so we look at everything in there, all of the organs, the lungs, the heart, liver, spleen, pancreas, prostate. So you'll get a full report on that. And we have a board certified radiologist that this is what he does. He reads these whole body scans and dictates a full report with all the findings. 2 other services we offer is thyroid. So there's a thyroid ultrasound and also carotid ultrasound that's included in those packages as well. So those are really important components that we need to look at as well.
It's all about anti-aging, right?
Mm-hmm. Yes.
What can we do to prevent complications, heart attacks, feeling bad in the future, even cancer detection? Because cancer can be asymptomatic for so long, and then all of a sudden, when you're symptomatic, it might be because you're actually a stage 4, which is
Yep.
metastatic spread throughout your body. So this is a great technology that's offered. I'm so excited for this.
Yeah, speaking on that, we find cancer at the very beginning stages of it. So you have stages 0 through 4, and we're finding cancers at 0 and 1. So we're able to give you that information, and you take control of it and get that removed. Or if it's a type of situation where it's kind of a watch and wait, you at least know it's there. It's having that knowledge, and the knowledge is essentially power. It's power over your health.
Yep. And that's, you know, a lifetime that you can spend longer with your kids and your family and friends, and just living life to the fullest, and that's what it's all about.
Yep.
Thank you so much, Ashley.